Hi guys, it's me again, Gareth Williams, specialist orthodontist. I thought I'd do a short video just to talk to you about what to expect when you come back into the dental practice in the post-COVID phase. Now, I'm sure many of you saw on the news during Boris Johnson's address that dental practices would be opening on the 8th. And I'm sure a few of you know by now that this is also the first point at which dental practices found out that they'd be opening on the 8th as well. There wasn't any prior consultation with dental practices, so this was quite a surprise across the industry. And you might be thinking, well, why hadn't dental practices prepared beforehand in terms of stocking up on things like personal protective equipment or getting their house in order in terms of guidances? There have been countless issues of different guidances that are ever changing as we find out more about this disease. Additionally, as dental practices, we have been advised not to store and stock up on these equipment as they are needed more urgently by medical care facilities. So that leaves many dental practices in a situation where getting ready for the 8th in a safe manner is a tall order and perhaps not at all possible. However, the plan is to at least open around that date, whether it take a week or a couple of weeks extra, as long as we are sure that the patients can be treated with the utmost regard for safety. Dental practices generate aerosol. Aerosol is something that's used to cool the drill down while dental work is performed. Early research seems to suggest that the aerosol can carry the virus and that virus can remain in the air for protracted periods of time. So there are risks to both parties, the dental team and also patients. Now there are methods which can minimize this risk, but it is important to note that that risk is non-zero and not trivial. Procedures that are in place to minimize the risk to patients of infection include introducing a fallow period after any generation of aerosol for an hour after the procedure. So a procedure will take place, that room is then locked, left for an hour, and then after that a clean is performed. That's to let the virus ground naturally and then be able to clean it off the surfaces. All of the standard cross-infection measures, which are industry standard, the use of autoclaves, the scrubbing of instruments, single-use instruments wherever possible, will of course be instigated as normal protocol. Additionally, measures will be taken to minimize the number of persons in the surgery and indeed the practice at any one time. This is particularly pertinent to orthodontic patients. So you might find as a parent attending with your child that you'll be asked to wait in the car while your child is seen by the dental team. The patient will be greeted at the door. When escorted to surgery, we will endeavour to keep a 2-metre distance, although when that distance is breached, that will be when personal protective equipment is worn. In terms of the waves of introducing patients back to the practice, the general consensus is that the first wave will involve emergency treatments, patients that are in pain who have had breakages to their orthodontic appliances or have other concerns. The second wave will then be delayed appointments, things like adjustment of fixed braces, removal of braces. The guidance is currently unclear and is unfortunately changing back and forth at the moment as we have some conflicting studies and opinions on whether the placement and removal of orthodontic appliances constitutes an aerosol generating procedure or not. That is something that is ever changing and we will have more information on by the time we are opening. In general, what we are trying to do at all points is strike a balance between the risk and the benefit to you as a patient. And it's as simple as that. You will be following up with patients within the next month. If you haven't heard anything within the next month, I would advise you to get in touch just so we can check that you haven't been lost in what is now quite a confusing system, unfortunately. I'm sorry that we've all had to go through this. As always, stay safe. Bye now.